Hey, this is Dr. Doug Lucas from PhD Weight Loss and Nutrition. Just going to do a quick post on intermittent fasting to go along with the blog post that I just put up on our website at myphdweightloss.com. So real quickly, some terminology. So intermittent fasting versus time restrictive feeding. Some people use them synonymously. They both mean some time period of not consuming, usually solid foods. But intermittent fasting is generally reserved for time periods greater than 24 hours of fasting, whereas time restrictive feeding is generally going to be cutting up that 24-hour time period to a feeding window and a fasting window. There are a lot of different windows that people will talk about as being effective, whether it be 8 hours of fasting, 12, 16, 22, and there is some self-experimentation out that needs to be done to determine kind of what's best for you and what works well for you. So let's talk real quick about the benefits of intermittent fasting. So intermittent fasting is not starvation. It is not severe caloric restriction. It is the willful removal of food from your diet, still consuming fluids, and there's a few different ways that you can fast with fluid consumption, but willfully removing food. And when you do that, your body has this really interesting hormonal response. Some of those responses are your blood glucose level will drop, especially if you're diabetic or metabolically not well. Your insulin sensitivity, which is part of having metabolic syndrome or metabolic disease, will improve very quickly. You will increase your ability to burn fat and actually release fat from your fat cells, which doesn't happen when you starve yourself on severe caloric restriction diets. And there's some evidence to suggest that you might improve your longevity as well. It does this through these hormonal processes. Number one would be growth hormone is secreted, particularly on longer fasts. Mostly is secreted at night, and it really helps to improve your ability to recover. It really helps to improve your immune system. So intermittent fasting and time restricted feeding can really benefit you there. Your stress hormones can actually go up, which is one of the reasons why we talked about not doing this during severe times of stress or poor sleep. But those stress hormones increasing can actually make you feel energetic. It can really promote the feeling of focus, and it is, from a ancestral standpoint, likely the result of your body feeling like you need to go find some food. But in our current culture, it's actually really helpful, to get through a busy clinic day or, whatever you have to do to get through your day. I think fasting can be really helpful, and that's the hormonal reason why. Most people, when they're introduced to this, will think that, gosh, if I fast, I'm going to lose muscle mass because I'm starving myself. And again, these are two different things. You actually, if you look at the studies, will find that the muscle mass is preserved during fasting episodes. And again, that's because from an ancestral standpoint, your body is trying to go out and find food. And if your body shut itself down, it wouldn't really work very well. If you are interested in nutritional ketosis, you'll find this is a good tool to, again, burn fat and start to see some ketones in your bloodstream. It is a great way to teach your body how to burn fat. And again, you're going to have excellent energy once you're able to do it well. I also find that people realize that they're not hungry during times of fasting, and they kind of figure out what to do with those feelings of hunger and separate the concepts of hunger versus craving. And there's a lot of tools that you can use to help with hunger. And remember that hunger does come in waves and hunger goes away. So again, those are all the hormonal benefits and what fasting can do for you. Severe caloric restriction, in comparison, is basically reducing your calorie consumption. And there's a whole lot of diets that will recommend that you do this. But when you do that, what you'll find is that your hormone changes are different. You'll find that your thyroid function decreases. You'll find that you feel tired. You don't sleep well. You are hungry, but you're hungry all the time. You have cravings all the time, rather than the satiated feeling that you have when you're truly fasting, because of the leptin ghrelin axis changes. And the growth hormone that I mentioned for fasting, it actually goes down and is not secreted as well, so you don't get good recovery with severe caloric restriction. So huge differences there. As far as how you should fast, I recommend starting out with short windows. We're already fasting. If you don't eat after dinner, you're probably doing a 12-hour fast to begin with. So you can simply just extend that to 16 and skip breakfast and see how you feel. And then extend that potentially to 24 and see how you feel. If you are diabetic, if you take insulin, if you take really any medication that has to deal with diseases of metabolic syndrome, check with your doctor first before you start this. You may find that you don't need those medications, and those medications might make you not feel well. So definitely do this with medical supervision. Otherwise, you may want to experiment with it, try it out, and see how you feel. Other people that should not fast include people that are women that are pregnant. There's no good evidence on fasting in children, so I wouldn't encourage that in your kids. But if you are an otherwise healthy, well adult, I think it's reasonable to try it out. Understand that you may not feel